Well, we've been reporting on the recent shortage of Adderall. Doctors believe the problem would ease this fall, but patients are still experiencing a shortfall.
So what does this mean for people who use the drug and for the focus and concentration? See, we have Dr. Kumar. She is on call this morning with important information on how to manage until the shortfall eases next year. We have a long wait.
Yep.
So let's start by talking about the shortage and why it's so important to make sure there is enough, because it treats a lot of people.
Yes. So Adderall is our key drug for treating attention deficit hyperactivity disorder. We use it in children, we use it in adults, and it increases focus, attention, and concentration. I mean, these are things that are vital for our survival. So for people that depend on this drug, it is essential for their activities of daily living. And to put in perspective, 41 million prescriptions for Adderall were written in the United States last year. So this supply chain issue is a big problem.
So what can patients do? Are there any alternatives that they can turn to in the short term?
Yeah, so I mean, that's the good thing. There are a lot of drugs that are out there to treat ADHD. 3 commonly used drugs are Ritalin, Concerta, and Strattera. But this is a process. So you have to work with your healthcare provider to find the drug that's right for you, because these drugs are going to affect people differently. But I say to people, you know, go into this with an open mindset, because you may end up finding a drug that actually works better for you in the long run.
And as for Adderall, can patients take a lower dose? There are reports that some patients are actually just cutting their dosage in half.
Yeah, we see people even skipping doses. Neither of these scenarios are ideal. The thing is, if you completely stop taking your medication, there will be withdrawal symptoms. You can have hyperactivity, headaches, panic attacks, difficulty sleeping. So we really don't want people to do that. In terms of cutting back on your dose, and we're seeing this because people are actually trying to ration their medications, it's a strategy you can talk to your healthcare provider about. Maybe something you might want to consider employing on a weekend when there's less demands for your attention. But we have to remember what this drug is for. This drug is for focus. Okay, so people who have undertreated ADHD can have difficulties at school, at work, with relationships, even driving a car.
Yeah.
There's an increase in car accidents. So you really want to be mindful about what you're doing on the days where you cut back on your medication.
So probably better to seek alternatives than trying to parcel it out.
Absolutely.
So you talk about 41, you said 41 million prescriptions for Adderall?
Last year.
Last year alone?
Yeah.
Okay, so that is a lot of people that need this medication. So let's talk about parents with kids that have ADHD and whatnot. What should they be looking out for now if they can't get the medication?
Absolutely. So if you are changing your child's medication or you are adjusting a dosage, you want to watch very closely for any changes in school or social interactions, because this is a big adjustment for a young brain. Additionally, it takes a village, right? Yeah. So you want to let teachers, you want to let coaches, other family members know what's going on so people can make accommodations while children are adjusting. And finally, healthy lifestyle goes such a long way. So getting exercise, good sleep, limiting screen time, and then also having a little bit more patience and understanding within the home as kids are adjusting. This will go a really long way.
Is the medical community at least hearing that this will be a problem that'll be solved sooner than later, or is this really looking, I mean, we say next year, that could be January, February, or it could be next December, right?
Right now, I think what we should do is we should just sort of prepare for the fact that we're not sure when this is coming back online. And so if we just sort of educate ourselves, get in touch with your healthcare providers now to try to find some alternatives, and hopefully sooner than later.
All right.
Dr. Kumar, thanks so much for taking some time to talk to us this morning. We really appreciate it.
Thank you.